Hi guys, welcome back to the Health is Wealth Connection. Today for our episode we have Brandy speaking with Nan, who is our brand new women's health nurse practitioner. We are so excited to have her as a part of our team, and today Brandy is going to kind of get to know Nan with you guys and also talk about some important aspects regarding women's health. I hope you enjoy, and if you have any questions, feel free to reach out to us and let us know. Here we go.
For joining us, or if you're checking in later, we appreciate it. I'm here to introduce Nan. She is new to our practice, and she is a women's health nurse practitioner. Going to be seeing patients like our traditional memberships, but also having a special focus on menopause, perimenopause, and conditions, when you're a teen, endometriosis, PCOS, all the topics that females go through. So, Nan, do you want to give us your background?
Hi. Well, thank you, first of all, for having me here at this practice. I'm super excited. I started out my career as a labor and delivery nurse and worked in labor and delivery for years and years, and then took some time off, had my babies, and then went back into labor and delivery. First, worked at St. Francis on the south side, and then went to St. Vincent Carmel, and then decided to get a little family practice, primary care experience, and just went to Our Health and did that for office nursing, and then decided I wanted to be a nurse practitioner. So a few years ago, I went back, got my master's in women's health, and here we are.
We got to have her for clinicals, so she's very familiar with practice. She's very familiar with the ins and outs, the staff. She knows all the intimate details from here. So we were super excited that we got to have her as a student, and now she's ready to start seeing her own patients.
Yeah.
So
very excited.
Yep, we hope you come and see her as well. She's a wife and she's a mother of 3, got 2 sons and a daughter. Let's see, so we have some questions. Can you tell us about any experiences or moments that made you want to help women navigate issues like menopause, fertility, painful periods, all this stuff?
Well, I feel like the most compelling experiences are often your own. And I would say that I personally dealt with infertility. So I had to get some help with our first child, conceiving with him. And looking back on that, I did all the procedures and I did ultimately was able to conceive, but didn't really focus on lifestyle changes or any of the other holistic things that you can do that I think really, really make a huge difference. And that to me just kind of highlighted the need for education on not just, going to an infertility specialist and getting the procedures, but all the other things that we can do to help. And I wanted to be part of helping with it. And then menopause, same. Right. Personal experience. menopause, just the life changes, the body changes, and just really overall life changes that occur during the stage of life. It's definitely coming to the forefront now, which is so great. So much more education about it. There's so much education that needs to be done, and
for sure,
love to help women with that as well.
Balancing those 4 pillars that we talked about, getting your hormones, your cortisol, and some of those things that you can't just do yourself. So you need somebody to help you with balancing them. Insulin and glucose is really big in a lot of these conditions too. How much we sleep, exercise, and just really helping with all of it.
Yeah.
Let's see here. So what do you find most important when working with women on their healthcare journey?
Most important, probably just meeting women where they are. Mm-hmm. And realizing as a practitioner, as a provider, that every woman comes with their own set of circumstances, their own medical history, their own family history, their own circumstances, socially, family, all the things. But each person, each woman needs to be individually cared for.
Yeah. I also think listening to their goals, because my goal may not be the patient's goal. So making sure that we're listening to that, we're listening to them subjectively tell us how do they feel and not just treating lab values. You can have lab values that are within normal range, but you don't feel well. And so we're going to listen to how you feel and safely treat you still within those values, but maybe optimize them better than we traditionally would.
Yeah. That's huge.
Okay. How important is it for women to prioritize their health and wellness, especially as they age?
That too is of utmost importance, because once you, as you age, it's kind of not expected, but like that's when your risks of cardiovascular disease, osteoporosis, cancer, as you age,
Memory.
they increase, memory, all the things. So if you can get in the mindset when you're younger to make those diet changes, get in a normal exercise routine, just kind of prepare your body and keep it healthy for long term, it has much better.
Yeah, even guys in your teens years and in your 20s, your 30s, hormones start to decline in 30s, guys. And so we're losing a lot of our testosterone. People who are super stressed out, your pregnenolone, your progesterone, things like that are going to be low. And sometimes even at a young age, we have to support those, whether it's not just fertility, it could be sleep, it could be anxiety, overthinking at night, can't shut down your mind.
Yeah.
So even starting as young as that, we want to look at your hormones and optimize them. So when you do go through perimenopause, menopause, we're right there along with you, and we know how to change that. And frequently checking labs, not just once every few years, we can catch it before you're even symptomatic too. And so I'll take this next one. It says, what's your advice for women who may feel overwhelmed by the changes that their body's going through and unsure where to turn? That's an easy one, guys. Come see us, come see Nan. We still have Melissa and Jill are still accepting patients as well. Janelle and I are currently on a wait list, but I would say come see us. We're going to meet you where you're at. We're going to make it fun. You're going to love the office. The support staff is just amazing.
Really is.
Yeah, we're proud for this group that's here. But the other one is start with our journal. So we have our new journal, and I don't know where I went to. That's okay. There's lots of pictures online for it, but it's out. You can order it through Amazon, but it's just some super easy changes if you aren't ready to commit, or if you're like, you know what, let me just dip a toe in and see, can I do this? Do I want to do it? And then hopefully you'll come see us too. So next, how do you work with your patients to create a personalized treatment plan that addresses their specific needs and concerns?
Well, I, again, meet them where they're at.
Yep. She's still getting a little lay land and learning her charting.
Yeah.
She knows the medicine. That clinically is super great. I think for us, the detailed HPI, so history of present illness, we call that. So getting a detailed, also a timeline. Love the timeline from functional medicine. When did your symptoms start? Lots of times when we figure that out, then we know the key of, okay, here's where we're going to start. We're going to figure things out. Family history, genetics, and then also exactly. Media where you're at. That's where a lot of this comes down to.
And I'm so excited to be here specifically because I think the ability to spend that time with a patient is so unique here. Mm-hmm. You don't get that anywhere else I've worked. It's great.
Yeah, we prepare before you come to your appointment, but we also go through, that's why we have these, annoying paperwork people. I get it too. I feel annoyed at times, but already tells us exactly what's going on before you come in. So we can start painting a picture. We can start preparing for you. And then when you come in, you get to tell us your story. But that way, so we really spend, several hours just leading up to that visit, plus at your visit, and then afterwards making a plan too. Labs, a lot of people say, hey, can you do a lab work first? Well, no, the labs are not just like a quick, easy panel. It's different for every single patient depending on your symptoms. We want to do that to save you money too, and save you some blood, because a lot of blood work if we just threw everything we wanted in it. And then of course we want to treat things, as we go, and not just try and treat 5 different things and overwhelm you. Right. Let's see. Either one of us can take these two. Difference between perimenopause and menopause, and when should women start expecting changes?
Well, both perimenopause and menopause are both stages, naturally occurring stages of a woman's life. Perimenopause is the stage before menopause, and that can last 4 to 10 years. The average age of menopause in the United States specifically is 51 and a half years old. So if you back that up 10 years, it's mid 30s. You can start perimenopause, and you see it's basically your hormones can become chaotic, and you see there's all kinds of fluctuations, and you can see all kinds of things, irregular periods and mood changes and weight gain, hair loss, so many things. And then menopause is 12 months after your last menstrual period, not having a period for 12 consecutive months. And in menopause, often those symptoms can actually intensify. Things you need to think about are, once your estrogen decreases, which is in menopause, you're at a higher risk for cardiovascular disease, osteoporosis, and some cancer, lots of different things
and before 50, if you're going through menopause. So our goal is, if you do go through menopause earlier, that we support those hormones to get you to that 50 range to hopefully decrease those issues you may have. Okay. So, are there lifestyle changes, supplements, or treatments that can help ease the transition of menopause? And I can take this one. Supplementation, there are some, but again, it's so individualized. We're just not going to throw a bunch of supplements depending on what your symptoms are. There's like rhubarb, there's things like that. Myoinositol, there's a new supplement coming out, and it's called Care, and that's through Orthomolecular. It looks awesome. So I'm excited to actually give that a try and get it in our office. So you'll be seeing that. That can support your insulin and glucose, and that can help as well. Chaseberry, something that can help. Less sugar, less alcohol. It doesn't mean you have to give everything up, right? Moderation, but if we can be 90% of the time good, that's great. You're going to feel better. And sometimes during hormonal changes, we do have to tighten things up a bit. And then, we can level things out, get hormones regulated, and everything gets a bit easier. And then avoiding plastics, avoiding having extra weight on us because that can cause increase in estrogens. Hormone therapy, we prefer to use bioidentical, so like your body makes, but we do use some of the traditional hormones as well because people may need it for a period of time, or they may just be unsure, or they may be seeing, their gynecologist. We work with the gynecologists as well. We've got great relationships with them. So every patient's unique depending on what they need. Heavy periods, they can be overwhelming. What can cause them? What can women do?
Hormone imbalances, also things like polyps, fibroids, endometriosis, many etiologies. Yeah, PCOS, estrogen dominance. Yes, so many things. You can manage them anywhere from hormonal to like birth control pill type hormones. There's probably some supplementation that
Lots of times if somebody's super uncomfortable, we may use those hormonal type treatments first just to kind of get to the root cause while we work on diet, exercise, the supplementation, because unfortunately the traditional things like birth control, it does work quickly. All the lifestyle changes we're making, supplementation, it's going to take 8 to 10 weeks. Nobody wants to wait that long or not feeling well. So we work ourselves backwards, right?
Right.
So I think that it's a good place to start for there. Other ones, fibroids, I think we talked about. Being overweight can cause that as well. Sometimes if you have a light period 1 month, maybe there's stressors, things like that. Then you have a super heavy period the next month as you're shedding that lining. So kind of balance it out.
Yeah.
So here's a good one. When should women seek advice for irregular periods or heavy periods?
Any time.
Yes.
Any abnormal uterine bleeding, you'll want to have it checked out. And then for irregular periods, things like that, they can often interfere with just daily life, missed work, missed schools. So you don't want to
embarrassment.
It's anywhere from exactly young to teenagers on up. So definitely.
I always say when to be concerned. If you're bleeding through more than a pad per hour, you're passing large clots, you're dizzy, shortness of breath, chest pain.
You could be anemic.
Yeah, you can be anemic. And I will say a lot of people do get anemic because maybe our diets aren't as good as they need to be. So often I will supplement with some iron and vitamin C that helps the iron stores. But again, you really need to have levels checked before you do that to make sure you're not getting iron overload. Let's see here. Can hormone imbalances contribute to both painful periods, fertility issues? Of course. Yeah, all those things. Then, endometriosis on here too. So go ahead and explain about endometriosis.
Endometriosis, what it is your endometrium, which is the lining of your uterus. It's growing kind of outside your uterus. The problem with that is it can cause inflammation, pain, scar tissue, which then in itself is, bad enough of an issue, but down the road, infertility, it can cause that,
it can be your bowel, yes, and bowel issue too, but pain, pelvic pain is very common causes.
Pain.
Okay, and then fibroids. So fibroids, abnormal growth, it can be by smooth muscle, it can be by, just any kind of tissue that's through there as well. They're considered to be tumors, but it doesn't mean that they are cancerous. Most of the time they're benign, but depending on how big they are, they can just cause problems. Pain, bleeding, things that women don't want to have to deal with. Okay, well, the last thing is we're going to announce our new women's health package. This can be something that Nan's going to be offering only through the office. She will see normal, traditional weight loss, executive, functional patients, but then also with this special because this is her love and passion. So she is going to be seeing patients, which you'll be able to come in for a 1-hour visit with her. Again, you're going to send all that paperwork in beforehand so we can be prepared for you. And then you'll have follow-up visits that are 45 minutes in length. You can use your insurance for your labs. We don't bill insurance for here, however. This is a cash pay. And then each visit will have a follow-up message that can come along with it as well. And let's see. She's going to be in here starting on Fridays, and then quickly, as she builds more patients, she'll build up to another 2 and 3 days too, so you know when to expect her. So, but she'll be here to answer all your questions, and we all work as a team. Anything else you can think of or want to add?
I'm just super excited. Can't wait.
We threw her in this last minute, and
Yeah.
I'm glad at least get you so you can see her face. You'll have a face with a name too, and I know you're going to be in great hands and really enjoy seeing her. So thanks for coming today. Hopefully you guys enjoy the beautiful weather.